We will be talking about how different actors impact and ideally mutually strengthen the resilience of health systems. Managing a health system in vulnerable or even conflictual settings is a challenging task, involving very different stakeholders and perspectives, while available means are always limited or at least contested. If then additional strains materialize, systems easily reach their breaking points. Particularly, reactions to pandemics vary considerably among states. Different amounts of available resources, health policies, and cultures of health help understand these variations. Access to health services may even become subject to political conditions at times. How can these different limitations or borders to health be overcome? What roles do states, science, and business play? What lessons can be drawn from a comparative analysis of responses to COVID-19? This afternoon, we look at these topics from 3 different perspectives. Stefan Woxström, Senior Vice President Europe and Canada at AstraZeneca, will be presenting an example for a corporate response to the pandemic and post-pandemic engagement to support sustainable and resilient healthcare. Amadou Garba Djirmay, in charge of schistosomiasis control at the World Health Organization's Department of Neglected Tropical Diseases, based in Geneva, will be elaborating on donations of medicine for neglected tropical diseases by pharmaceutical companies and their public health impact. Finally, Kaspar Wyss is professor at the University of Basel, trained in epidemiology and public health, but also holds an MBA. He acts as deputy director of the Swiss TPH and heads one of its departments, the Swiss Center for International Health. He will be looking at health systems' resilience and how to overcome vaccine inequities using the pandemic as entry door, focusing on an epidemiology and research perspective. My name is Oliver Fink. I'm a researcher with the University of Basel and the Herbert C. Kellman Institute for Interactive Conflict Transformation. I will be moderating this session, and I'm very much looking forward to your presentations. So each panelist will have approximately 5 minutes for the presentation before we are opening it for a more interactive format, questions, discussions, also from the audience members. So, Stefan.
Thank you. So, thank you all for inviting me to this session. It's an honor to be here and being among you who are working for maintaining peace and promoting that. It's an honor to speak to you. I'm working for a pharmaceutical company. I've been with the company for 27 years. Most of the time I've spent in Middle East, Africa, Central Eastern Europe, in Central Asia, Caucasus, and working with these countries. My latest posting was 5 years in Japan, and I recently arrived back to Europe after many, many years. So I'm trying to provide a little bit that perspective on this, but also AstraZeneca and AstraZeneca's response to the COVID-19. I hope you will find it interesting. Well, COVID-19 happened, and in the beginning of the pandemic, and let's go to the first slide. We had let's see if we can get to the next. Oh, perfect, thank you. When this happened, AstraZeneca quickly took decisions that we will be engaged in this one. We said the first thing we did was actually engaging, thank you very much, 50 top scientists that we have to see, can we find any COVID treatment? And we started to engage them very, very quickly. We also started to engage in diagnostics and see how can we improve diagnostics and make sure that could be also distributed. The third thing we did was actually to distribute masks 9 million masks quickly distributed. That was the immediate response. But then we got a phone call from the medical regis from Oxford University, John Bell. He called us up and said if we want to be partnered to them on a vaccine. And it took us less than a week to say yes to that. It was a very, very easy decision to make within AstraZeneca. We're trying to improve patients' lives, so we want to be engaged in this. And it was also at no profit, this one. So what we immediately did was actually to engage in this new platform of virus. We started 20 clinical trials, engaged 65,000 patients in 15 countries immediately at risk. We had no idea if this vaccine were going to work. When you have a vaccine and we know it works, you need to distribute the vaccine. We have all over the world 25 partners who can manufacture vaccine. Vaccine is not easy to manufacture. There's certain facilities, they need to have some certain standards, qualifications. So it's a very complex process. And it's not just manufacturing, it's also filling and then distributing. And when it comes to distribution, we also have a lot of partners. We work with WHO, we work with UNICEF, we work with United Nations, of course, as I said, and we work with Gavi, COVAX, and other institutions to help to bring an equitable access around the world, because this was what we wanted to do. And if you look on the next slide, you will see, I have a slide changer. We actually know now, afterwards, when all the documentation is catching up and the publications are coming, that we were able to save 6 million lives in the first year of the pandemic when we started to distribute the vaccine, from our vaccine. We manufactured and distributed 3 billion doses around the world to 180 countries. 2/3 of those were to mid and low income countries. And I think that was an enormous effort that we did, where we would never be able to do this without partners. And I think we'll go more deeply into that as we go. But I think we're really proud of this as a company, and I think if this happens again, we will definitely make the absolute same decision. But the COVID is not over. For most of us, it's over. But when we start to go out on the street, others are going back in again because they're so afraid to be contaminated. There are immunocompromised patients out there. It's about 2% of the population. For example, patients with gone through transplants, patients who are having treatment for blood cancers or hematology diseases. There are also patients who are going through dialysis, very vulnerable. Even if you give them a vaccine, they can't translate that vaccine into antibodies. So what you can do, you can actually treat them with already made antibodies and you can inject them. What we see today in those who are hospitalized, they're overrepresented. They represent 2% of the population, but 40% of those who are in hospitals. And those are risking a very, very, very high, there's a very high risk that they might even not make it. So the deadliness among those are very high. I think that is something that needs to be highlighted, and this is where AstraZeneca is currently focusing. It's very few patients, but there's a very high medical need. And we're chasing the new variants with new antibodies and try to test against those. So there's still a lot to do on COVID-19, even though we might not know it. Patient groups, many of those patient groups aren't very active and they can't speak for themselves very well, so we need to make sure they also can do that, to make sure they can get access to these new treatments for COVID-19. Now, what we discovered, it's a lot of text on this one, so before you start reading all the text, we discovered through the pandemic that health systems are very vulnerable. You know, all health systems have issues with, in some part of the world, it's a very fast-growing population. In other part of the world, we have a fast-aging population, but we have also sustainability and, you know, all these global warming that is happening as well. They're putting pressure on different types of diseases as well. All that is affecting healthcare systems, and they're under really tough pressure. On top of that, also economically under pressure. So how can we make healthcare systems to be more resilient and also tackle also sustainability? This is something that we had in mind, and we started to talk to organizations like World Economic Forum and London School of Economics, and together we created something that you can see here we call PHSSR. It's an approach to assess healthcare systems around the world and see how can we also see their vulnerability and how can we address that vulnerability. You can see areas here that we are addressing on this. And we have now assessed 30 countries around the world. Of course, we started very centrally in Europe, but we've gone also outside Europe, of course, to other countries, to mid-income countries, but also low-income countries. We will, in wave 3, as you can see here, there are 3 phases. We will focus very much on low-income countries and see how we can do that. There's a lot of learnings to be shared. In many of these, now results from these assessments we have done, governments have taken action, clear actions to strengthen their healthcare systems. I was recently, as I said, in Japan, and what's going into their budget proposals for the next term in the government are clear proposals to strengthen the Japanese healthcare system that comes out from this PHSSR approach. You can see also we have a lot of other partners that are joining this one. I think it's a very, very good and fruitful way of bringing learnings together and stand up against the next pandemic or other challenges that healthcare systems have. I mean, with that, I would like to say thank you very much for listening. And we all want peace, we all want health. The question is, and I hope that's going to be an interesting conversation today, can actually health, by strengthening health, can that also lead to better peace in the world? Let's see. Interesting conversations today. Thank you very much.
Thank you.
Good afternoon. I'd like first to thank the organizers for inviting me to talk about one experience on donation of medicine for public health. And this donation is for neglected tropical disease that are a group of 20 diseases affecting really people that are living in difficult conditions in rural areas where sometimes the access to healthcare is really difficult. So this program is running for, I would say, 20 years, and it is expanding. And the control and elimination of neglected tropical disease is part of the Sustainable Development Goal number 3.3, where UN called for the elimination of these neglected tropical diseases. So in 2020, the World Health Assembly has adopted a resolution on the roadmap for the elimination and the control of these 20 diseases by 2030. And this is something which cannot be done without this support of medicines, because the access to medicine is important. We need also to think about the financial cost of these medicines, which is really high, given the income of these people that are living where the access, the financial access, and also the geographical access to health facilities is really a big challenge. So this donation started in 1987 with the onchocerciasis program, which was supported by the World Bank. And this support was provided by MSD which donated free ivermectin to treat onchocerciasis, which is the debilitating disease leading to blindness, with the consequence on the work of people living in this area and their ability also to get resources for their own life. And MSD was followed in 1997 by Merck for lymphatic filariasis, and in 1998 by Pfizer for the donation of Zitromax for the blinding trachoma. And then many other companies followed this support for neglected tropical disease. So you can see for the last 10 years, the global donation, the number of treatment that have been provided to globally. So it's about, you can see in 2018, more than 2.9 billion treatment have been provided globally. So the last 2 years have been affected by the COVID-19 pandemic, but the program didn't stop, it continued with some problems, and the system were resilient to continue delivering the interventions. In terms of number of people treated, you can see that it's about 1 billion of people that are treated yearly with this donation of medicine. The last 2 years also have been affected by the COVID, but the health system have been really resilient, because you can see, despite the COVID, the program continues, and in 2021, it has been able also to increase the number of people treated globally. So the impact of this donation is the elimination of disease that can be eliminated globally, because the medicine exists, the other tools exist, and there are diseases that can disappear from the world with the strategy which is currently implemented. So you can see that so far, 46 countries have eliminated at least one neglected tropical disease. And for the diseases that have not been eliminated also, we have a decrease in the number of people requiring the intervention globally. And the objective is to have a 90% decrease of the number requiring intervention for neglected tropical disease by 2030. So this has been possible with the support to date of 12 pharmaceutical companies that are supporting the program by donation of medicine for the treatment of the affected populations. So we have GSK, Novartis, etc., but also with the support of companies that have experience in logistics, such as DHL or Crown Agent, that support also the WHO in the delivery of this medicine to countries. So it's important, I think, to show that the system has been resilient, and also it's a program which is supported through collaboration between the ministries of health, the pharmaceutical companies, WHO, but also you have the contribution of the population also that are receiving the intervention. So it's about collaboration and partnership. And I think also last, that providing care to people living in remote area, people that sometimes can feel that they are left by the system, they are abandoned, is something which can prevent, I think, conflict, and which also can build peace in this area. Thank you.
wait. Okay. Good. Thank you very much also for giving me the introduction, the possibility for having some short introductory words. I think obviously I could talk now for at least 1 hour, both on the conceptual, theoretical level, but also on the operational level about health system resilience. It's not the time to do so today, but it's more maybe an opportunity to bring in, let's say, some considerations. What can or should be the role of research also in tackle inequities, also in a perspective of questions around conflict and conflict prevention. So that will be some few minutes I have at this position. I will try to briefly focus on. Let me maybe also start first anecdotally with something. I remember quite well in February 2020, we had a panel here just opposite at the University Hospital, with, at the time being Lukas Engelberger, who is the local Minister of Health here in Basel, and with Thomas Stefan, who is the Council Doctor of the Kantonsarzt of Basel-Stadt. So quite relatively important figures. It was at the time being when we had the very first COVID case in Basel. In fact, it was somebody living in Riechen who has been in Milano for a weekend and brought back COVID, and big upset in the newspapers, but also in the public, a lot of concerns. But we were basically in a panel there and thinking, yes, this is a little bit of more hot story than we will eat it, or a lot more hot food than we will eat it. But some days later, the world has really transformed, and we were living in another world in a certain way. I say that in a certain way that we were all absolutely not prepared at the time being. And some days even we entered in this pandemic stage. None of us health professionals for decades were not believing really that this will happen, what then has happened. So in other words, when we speak, let's say, about health system resilience, and that's basically from Margaret Cook, a quotation which you see on a screen, which has the first person who has tried to outline what is resilience. We were also basically very badly prepared to what has happened then. So we were not prepared to effectively respond to what has come up and to organize in a way to need what the society and people need. Resilience since has been conceptually but also operationally been very much carried forward. That's a quotation now, also a framework, let's say, from a student of mine, where we have been working on what really are attributes, what makes a society but also a health system resilient to crisis. It's obviously not only something we know in the narrow sense of health services. Resilient you can also to be natural disasters, to all type of conflicts, to crises as we witness these days in Ukraine. And so an important dimension is definitely to be first aware, but then also have the capacity to react. I think we have learned here. I'm definitely very optimistic that it wouldn't happen again, to be as unprepared as we have been in February 2020 or in January, February 2020, where many of us were thinking that will never happen. And I include myself. If you would have said me at the time being, there is a pandemic emerging, I would say I would have started to laugh about that. But I have learned, and I think that's also something we all should take with us in terms of being prepared for possible similar future events. In terms of research, we have seen a lot. I was earlier that week just looking briefly up PubMed. Since then, there have been over 300,000 publications, scientific publications on COVID. So if you type in the keyword COVID, you get to over 300,000 publications. If you put in COVID and vaccine, you get over 33,000 publications in less than 3 years. So, yeah, I will handle it. Don't worry. 3, I will handle.
Okay.
So, but an incredible amount of new knowledge, scientific knowledge. We have seen also the AstraZeneca case. Never it would have thought, if I would have asked you how long does it take to get, let's say, a vaccine 3 years ago, you would say me it takes 10 years. It has been done in basically a little bit more than a year. In the AstraZeneca case, maybe 15 months. But there were things happening we never would have thought beforehand in terms of diagnostics, vaccines, laboratory science, really incredible steps forward in an extremely short timeline. Science has also been able to guide policy. I think interactions between science and policy planning, decision-making were previously a bumpy road, has, let's say, in many instances shown to work out. Still sometimes bumpy, but still has been able to work out. So I think here we have really seen major progress and a lot of good elements. Why does it not move forward? Oh, now. On the other side, and that's a little bit contrary to your slide in terms of the very nice coverage of the AstraZeneca vaccine, we have also we see extremely strong inequities in terms, for example, of vaccine coverage. So that's also the status of beginning of January. Only first vaccine, 1 dose, and we see the world is extremely unequal. And we have seen a lot of tensions, high-income countries who have taken basically many of what you needed to control for the pandemic at their end. Masks were available in Europe, they were not available in other countries. It's not only the vaccine. Oxygen aspirators at the beginning, they were available in European countries, but not in low-income countries. So science has done a lot, but it has not given us the answer to these questions. So the question, how we really make sure that these goods, these innovations, these products are really also effectively and effectively available for all population groups across the globe. So, and here we have no answer. And don't ask me how to do that, but I just want to flag it as an issue, and specifically also to the most vulnerable population groups. So, what take we with that? I deliberately put the World Economic Forum on the slides because, let's say, the motto of this week's event in Davos, and it's still ongoing, is what means cooperation in a fragmented world. And I think we really have evolved in a more fragmented world in many, let's say, sense. So we see, yes, resilience and pandemic preparedness is essential, and that is recognized by many. Meanwhile, I think many are also much better prepared in these areas. But let's say, how to do against the inequities which still do prevail, here is still a lot to be done. And we know that this will be also the source of many future and upcoming and already ongoing conflicts, migration patterns, and many other aspects. And that's maybe also a short stimulus now, maybe also for the debate, so that we can maybe also look a little bit how we can do better here, including also science. By that, I have maybe overrun 2 minutes, but thank you very much for giving me the 2 additional minutes.
Thank you. Thank you very much to everyone. We have slightly less time for the interaction than I anticipated. So maybe in a slight change of plans, can we get the final slide from the last presentation again? Is that possible? Because some of the questions that I thought might be interesting to elaborate further. Yeah, no, the other one.
Maybe yes.
This one, perfect. Yes, thank you very much. we have heard again how, which massive shock, disruption, wake-up call for health systems worldwide the COVID pandemic was. So, what are learnings from that? In the responses, in the impact on other, resource distribution issues. What do we need to make health systems better and ready for future crises? Resilience, pandemic preparedness, cooperation. Maybe you could each briefly comment on that.
We learned a lot during the pandemic. I mean, we started to, our vaccine was at no profit. So that was the first step for having equitable access to medicines that countries can afford. But we also learned that that's not enough. We need to do much more than that. Delivering vaccine to the borders of a country, a low-income country, who doesn't have a healthcare system that can take care of that and distribute that. That's another hurdle. And here we need to work, of course, in partnerships to address this. But again, we're coming back to there is underlying issues with healthcare systems that we need to prepare them and build them up. And they had already problems before, perhaps with they have a fast-growing population in some countries which cannot take care of healthcare systems already, and then you have a pandemic on top of that. So there's so much learning and preparedness that needs to be done. And I think we need to, for some countries, it's a build-up of healthcare systems. In other countries, maybe more high-income countries, there's also another issue we learned. We don't invest in preventive care. OECD numbers show that of the healthcare funding, only 3% is going to preventive care, and the rest is going to patients who already have a disease. Can we prevent diseases instead? That will make the healthcare system more resilient, and maybe we can start thinking about the healthcare funding more as an investment rather than a cost that needs to be under pressure and minimized. So I think there's so much learning to do for the high-income countries, but also for the low-income countries in case of another pandemic, for example.
Thank you.
Thank you. I think the COVID-19 pandemic impacted the health system with disruption of activities that are linked to, I would say, preventive chemotherapy, vaccination, malaria, etc. But the system have been able to be resilient because of the integration of activities. Because the COVID-19, which is really a well-funded activity, have been taken as a platform to deliver the other interventions that have been slowed because of the epidemics. But it's also important to think about the collaboration and partnership. I think this is something which is really important in low-income countries for the delivery of the intervention. Because you have the company which is donating the medicine, but you have also all the logistic which is behind this donation. And the donation need also to be adapted to the situation of countries, such as the availability of cold chain, etc. So the capacity of countries to dealing with this kind of consideration is important. And we have also the health system and communities who also participate to the health system by contributing to the distribution, to health education activities, etc. So in the situation of neglected tropical disease, the distribution of the medicine was a platform to sensitize the population on the COVID-19 and the how to prevent it. For example, all the distanciation, etc., was explained during the distribution of medicine. So I think integration is important, partnership is important, the logistic is also an important point to think about. Thank you.
Okay, maybe just to somehow, yes, prevention is essential, huh? And I think that's public health is about prevention, and that's see also a colleague from the Public Health Schweiz here in the audience, and I think we would be the first to preach around that since decades, huh? If we are allowed to be preachers, but yeah. So yes, prevention is definitively in all sorts, huh? In terms of lifestyle behavior, in terms also of pandemic prevention, in all the spectrum. Yes, there are technical aspects which are very important. I think we mentioned the capacity of a health systems to innovate. That I think was done, in my opinion, at the end very good. We were really able to have a lot of new elements which we need to control for a newly emerging disease. In that instance, a virus, a new one. So technically, that was even better than optimally handled. We have supply chains issues. They are more difficult than systems issue we know from the past. They are much more difficult to fix, but at the end, I think there are also solutions here. We have human resource issues, workforce shortages, not only in low-income countries, but also in high-income countries. More complex even, we still struggle. The UK these days is very much in the news around that, but also Switzerland, and so it's not only low-income countries who struggle with that. Much more difficult to fix these issues. But at the end, we have also seen a paradox, huh? And specifically if you go back to the vaccine stories, when the first vaccines became available, the low-income countries and middle-income countries wanted to have them, but they were not given to them. Huh? So the high-income countries said, we first. Huh? Switzerland said, we first want to have our population vaccinated. Low-income countries were left with some exceptions on the side. The paradox here, now we have enough, and the high-income countries don't want them, and the low-income countries want them neither. Huh? So we have also seen last week, Switzerland wanted to give for free the drugs in stocks. The low-income countries didn't want them any longer. Huh? So it's a certain way, a paradox we have meanwhile. That said, these issues we speak about, they are partially technical to an important degree, but they are also political. Huh? And that means political in terms of values we have, in terms of commitment, but obviously also in partnership. So this means each of the actors also needs to work together really to tackle these aspects.
Yeah, thank you very much. So we are slowly approaching the end. I just want to have maybe one final sentence comment on the third point on the inequities, inequalities, because that's also a question that I got from the audience. What is being done at an institutional level or beyond to address the global inequalities that were unveiled by the pandemic? Maybe very, very concise final point, and then I wrap it up to have enough time for a tiny break and the next session.
Yeah, I think we mentioned many of these things. We have great learnings about inequality. One is of course, we said it needs to be affordable. The other one, it needs to be distributed, and it needs to be, of course, infrastructure in the healthcare to provide medicines. That's going to be very important. But I think going forward, there are also other things that we could use. Digital, for example, is a way of spreading information. It's a way of spreading knowledge. It's a way of training healthcare providers. We need also address the clinical trial diversity across the world as well, and test our medicines in everywhere in the world. That's or in different kinds of places in the world. I think it's very, very important. I think it's also that we go also a little bit beyond the pandemic and the vaccine, and think about other things. You talk about infectious diseases and rare diseases. We're also talking about non-communicable diseases, look, for example, at blood pressures in low-income countries, that is growing very, very fast. That's going to lead to severe disease later on, MIs, so heart attacks or heart failure. That's going to put additional burden on healthcare. I think we need to address these things. And we are currently screening. We screen 30 million patients in Africa and putting them on modern treatment that are affordable. And I think more projects needs to be that. And that can only be done with partnerships. I think that's going to be a very good solution to this.
Thank you.
Yeah, WHO is promoting the universal health coverage, the access for all to health. And it's important when there is this kind of situation with a pandemic, like the COVID-19 pandemic, that when an intervention is available, everybody needs really to have access to these interventions. And we have seen, as described by Kaspar, the inequity that can raise in this kind of situation. So there is a need, I think, to think about a system, a global system for access for all to this kind of intervention when we have a problem of epidemics or like this. And this system is important, I think. This is the only way because low-income countries cannot afford the vaccine or the medicines. But globally, I think putting a system in place so that everyone can have access to the intervention is important because the disease has no border. Yeah. Treating everyone or every country is also preventing the disease to spread to your own country. And this, I think, is important for politics to think about that. Yeah. They can close border or doing many other interventions to try to stop the disease. But when you take this kind of intervention, the virus is already in the country. Yeah. So providing the care for all and setting a system in partnership would be maybe the way to go.
Thank you.
Yeah, I think social corporate responsibility schemes are extremely important and also very good. So that's really a good step, what you describe, the commitment of AstraZeneca, but also of other pharmaceutical companies to really also better cover for infectious diseases or also chronic diseases, persons and population groups in more deprived contexts. So but that alone will not do it. So I think more is needed. And I think if we reflect once a little bit about also history, let's say, if you go back to the whole system about the first movement for social security mechanisms, that was in the times of Bismarck. In Germany, a Preußen general military person, most likely not having now very communitarian and communitaristic values, but he was just seeing if there is not a strong commitment to redistribute wealth and income, that will be in the midterm lead to major problems. And I think, so we are maybe not so far away from the situation in the 80s towards the second period of the industrial period, that there is, in my opinion, a stronger need for commitment for redistribution between the high-income settings and the more middle and low-income settings. Because otherwise, again, in terms of conflict, we can be relatively sure that the conflicts will raise to an extent that they will be getting difficult to control. And that's not only for health true, it's also for other dimensions true. And to work in that direction is, in my opinion, quite important.
Thank you.
I think the fact that we're working in this PHSSR project that you saw, World Economic Forum is very much engaged in this one, and it's getting more attention. I think that is growing, and it's been very much debated at the ongoing World Economic Forum, and I hope that could be an embryo of addressing also that question that you're saying as well. Even though we're assessing country by country, but it's also being debated, the outcome of that and the need for countries. Specifically now we're going with this into low-income countries and assessing those healthcare systems. I hope that can be part of it.
Thank you.